Are you a young athlete and had sustained a concussion playing soccer or basketball, football, or been in a car accident or suffered any fall? Some of the symptoms you might be experiencing are just not feeling quite yourself, and other people may have also observed that. You may be having headaches or being sensitive to light or noise or stimulation, trouble concentrating or organizing your thoughts. Socially kind of dropped out, left your peer group and feeling like a loss of confidence. All of these are kind of classic symptoms as a result of having had a concussion or an injury. And I'm here to tell you I can help. The modality that there's two modalities I want to talk about. Craniosacral therapy is really a wonderful method, and Feldenkrais as well. I myself had a car accident, so I know firsthand what you're going through. I experienced a lot of the symptoms you're experiencing, and I want to tell you that there is hope. I know right now you're resting and taking it easy, which is well and good, but I want to tell you there's more that can happen. And so with craniosacral therapy, we use a very light touch method to remove compressive forces that got kind of stuck inside of you, that have become inertial, and help to get them out of your system. It's really through listening to your own body, through a sort of feedback system with your own body and your body's own inherent intelligence that can return you to yourself again, to balance in your nervous system. In the Feldenkrais method, we use sensing and feeling associated with movement to awaken the brain and form new combinations. So it's under the umbrella of what's called now neuroplasticity, where your brain actually gets rewired and forms new combinations. So these are alternative methods that I think we'll be seeing a lot more of in the future in terms of helping young athletes who've sustained concussions and help them get back to feeling themselves and get back to playing again.
Over the course of about 10 years rock climbing, I've developed some lower back issues, and it got really bad a couple of years ago. I started having back spasms. I'd have to lie on the ground and wait for them to pass. I had an incredible tightness in my back. I had limited flexibility and range of movement. And this is all no good if you're a rock climber. You really need to be very flexible and strong and loose when you need to be. And I felt pretty tight, and I spent a lot of time actually massaging my lower back and trying to sit differently and stretching. And what I didn't realize is that a lot of it had to do with my hip, and that's what Dr. Feldman really took me through, is that with Feldenkrais, that my hip was locked. My left hip was just locked in place, and my whole body was overcompensating because of this. Through Feldenkrais and through various methods that Dr. Feldman used, he was able to unstick it, and I felt immediately more balanced. My posture became more upright, and I just felt like I hadn't in years. I've enjoyed pain-free movement. I've gotten back on the rocks, and I feel a lot better. I've been able to regain my life.